Hi, Tanya.
Hi, sir.
So you have gone through the session, right? Last time we have discussed about the COPA step 1. I have given you exercises. So you have understood the concept very well.
Yes, sir. I understood.
Okay, understand. So today we will discuss the next step of COPA, that is COPA step 2, right? And we will also practice some of the scenarios related to it.
Okay, sir.
So as you already know, there are two steps. With the help of two steps, we can get the CPT code, right, Tanya?
Yes, sir.
That is, these are the two steps, right? Medical decision making and time. Am I correct?
Yes, sir. MDM and time.
Yes. Now, as you already know that this grid we follow, why do we follow this grid? So that we will get the appropriate CPT codes. If you see here, number and complexity of problem addressed, that is total number of diagnosis, right? COPA. This is called as COPA, whereas this is the data point, this is the risk table, right? So these are the columns, three columns we have. With the calculation of these three columns, we will get appropriate CPT codes. I think you already know this. We have discussed this earlier also, right?
Yes, sir.
Okay. So let's discuss. I'm sorry, yeah, 2 minutes later. So when we see, I think there is some discrepancy. Let's see. Yeah. So in case of today, we'll discuss more in detail about the COPA step 2, right? So as we say that MDM table, we have under MDM the problem point. So problem point is also called as COPA. Am I correct, Tanya?
Yes, sir.
What is the full form of COPA, Tanya? Any idea about that?
Complexity of problem address.
Absolutely correct. Complexity of problem addressed. And we have also seen there are 4 steps of COPA. That is total number of diagnosis under assessment and plan, total number of diagnosis addressed, nature of address problem, and level of problem point. This is what our motto is, to get the level of problem point. So when we get the level of problem point, level of data point, and level of risk, with the help of these 3 calculations, we will get the CPT code. So as we have already discussed in our last session about total number of diagnosis under assessment and plan, now we are going to see total number of diagnosis addressed.
Okay, sir.
So let's see the very first step which we have here. The second step which we are talking out is total number of diagnosis addressed. Already in our last session, we have discussed about the diagnosis. Do you remember, Tanya? That is the Z codes and integral symptoms. Do you remember that?
Yes, sir.
Yeah, so Z codes and integral symptoms, we excluding these two, we consider all the conditions which are there under assessment and plan. Now, you understand the meaning of diagnosis now. Now, the second word which you need to understand is addressed. Now, what I did that I split this addressed into 4 criteria. One is diagnostic test, one is the status, the next one is the treatment, and the discussion. So when you see out of the 4, if any one criteria is present in the note regarding the diagnosis given under assessment and plan, you can consider them as addressed. Do you understand, Tanya?
Yes, sir.
Okay, so I will one by one we will go in detail of all these 4 criterias and try to understand how it looks like and what is, and with the examples. If you do with examples, I think you can understand better.
Okay, sir.
So the first criteria I told you is diagnostic test. So what do I mean? What do we mean by diagnostic test? We say that the test like radiology test, pathology test, medicine section test like X-ray, CT, MRI, EKG, right? When you see all these tests as an order or review, right, you can consider them as the test. Now physician job is that whatever conditions are under assessment and plan, for those conditions, whether my physician has ordered the test or reviewed the test in the note, that will help you understand that this condition is addressed. Right? I will explain you with example. Let's see, under assessment and plan, we have how many conditions under assessment and plan, Tanya?
3 conditions.
Three conditions, that is bronchitis, atrial fibrillation, osteoarthritis, right? Now if we check here, bronchitis, doctor said he has ordered the chest x-ray. So when he orders the x-ray, so x-ray, chest x-ray comes under test section, so we can say that the bronchitis is addressed. If we check atrial fibrillation, when I say atrial fibrillation, ekg is normal, that indicates you that my doctor has reviewed the test related to atrial fibrillation, so it is related to that, so that also you can consider it as addressed. Whereas if you see osteoarthritis, physician has mentioned follow-up. In the entire note, you have no information about osteoarthritis, but only under assessment, if physician has mentioned follow-up, you cannot consider osteoarthritis as addressed. So in this case, we can say that only two diagnoses addressed, bronchitis as well as atrial fibrillation. Do you understand that?
Yes, sir.
Okay. So let's check the second criteria. That is status. When you say status improved, can you see the status improved, right? What do you mean by status? Status of the condition which is documented under assessment and plan. Now, this status can be present anywhere in the note. It is not necessary that all the status must be mentioned under assessment and plan. They can write in the history section, or they can write anywhere in the note, but you need to be very careful that you should not say that status must be documented under assessment and plan. What do we mean by status? Status means status of a condition like hypertension, stable, right? We have examples in front of you to understand. If you see here under assessment and plan, we have three conditions here. Now, when you check here, they said cough, refer to another doctor. Hypertension, stable. Now, stable indicates you that it is addressed. Osteoporosis. Now, stable is a status. Am I correct, Tanya? Status, stable you can consider as a status because it is telling you the status of hypertension. Do you understand that?
Yes, sir.
Okay, even in osteoporosis, if you check osteoporosis improved. Now, this also you can consider it as a status because it is telling you that the status of osteoporosis in our visit is improved, right? So this is also status. If you see cough, when they write cough and they write refer to another doctor, now this referring to another doctor cannot be considered as address. You need to have some other evidence in the note which says that that this condition cough is addressed. Am I clear?
Yes, sir. Clear.
So just by looking at the term follow-up or refer to another doctor, and there is no other information about that condition in the note, you cannot consider with these terms as addressed. Refer to another doctor, follow-up. I hope it is clear to you. So we will see the next criteria, that is the treatment. So when we say treatment, it can be like future treatments or past treatment, whatever they have suggested. They're planning to give treatment for a particular condition which is documented under assessment. You can consider them as treatment or addressed. You can consider them as addressed. For example, see, I've given few of the examples for treatment. If you see here, surgery, medicines, therapy, etc. A few of the examples for your understanding. So if you see here, Tanya, how many conditions here?
2 conditions.
So we have two conditions here now. So if you see, Tanya, in front of peptic ulcer, there is a doctor has suggested, a doctor said on medicine, right? So this is addressed on medicine. Yes, they are talking about the treatment. RF, what is RF? Open reduction internal fixation. This is a procedure which physician has performed 2 weeks ago. So in this case, you can say that this is also a treatment which they have done 2 weeks ago. This also you can consider it as address. So how many conditions addressed in this case? Are you able to hear me, Tanya? How many conditions are addressed in this case?
2.
Two conditions. So total number of diagnosis 2 and total number of diagnosis addressed is also 2. So I hope you understand the meaning of treatment. Treatment means surgery, medicines, therapy, right?
Yes.
Now let's talk about the fourth criteria which we have here is discussion about the diagnosis anywhere in the note, right? Especially in the HPI section, you will get this information. But sometimes physician document this information under assessment and plan, right? So if you check the two examples, what do you mean by discussion? They're talking about that condition, like from how long patient is having the condition, right? What is the severity of the condition? Severity mostly we consider under status, but you can see from how long patient is having, what are the symptoms related to it, can we see any integral symptoms documented in the note, right? All this you can consider it as discussion about the diagnosis. Mostly under HPI section you get it, but some physician do document under assessment and plan. So if you check this example, that is in this example, you see there are two conditions, peptic ulcer and kidney stone. So total number of diagnoses under assessment and plan is 2, right? Whereas if you see total number of diagnoses addressed, how many addressed? We have only one condition addressed, right? That is peptic ulcer. Because if you see here, they have written condition present from last 1 month. Did you check that? So condition present from last 1 month. This is the discussion which they are, which they have mentioned under assessment and plan. Mostly they document in the HPI, but some of the physicians do document in these areas too. So you need to understand that peptic ulcer, you can consider in this case is addressed, whereas kidney stone follow-up. Now, only the word follow-up is not enough. I need other evidences. We need another evidence, like in the history P, something about the status, treatment, as you have seen the 4 criteria, test, right? If out of the 4, if nothing is there, only the term follow up or refer to another doctor, you cannot consider them as addressed. If you see here, total number of diagnoses under assessment and plan is 2, that is just step 1. And step 2 COPA, total number of diagnoses addressed is only 1. Why? Because only the term follow up is not enough. That is the reason we are saying to all the coders, do not check only the assessment and plan. You need to read the entire note to understand that whether the condition is addressed or not. Because if you check only assessment and plan, then it is very confusing. Sometimes people just look at follow-up and they don't consider it as addressed, but you need to read your entire note and then actually decide whether out of the 4, anywhere in the note, do they mention the criteria or not? Not only under assessment and plan. I hope it is clear to you, Tanya.
Yes, sir.
Okay. So now I have another step which you need to be very careful. Now you have one question that, we have resolved the question, that is, why do we look at the address? The address stands for how many conditions my physician has seen in the encounter. Now, what is the another benefit of knowing address? So I have written a statement here. If you read here, it says in evaluation and management, we code the ICDs for the conditions which are addressed. So understand, whatever conditions are addressed, only those ICDs we code and all the Z codes we code, right? So you need to be very careful that how many conditions addressed. Why we look at, so that another benefit is you need to decide how many diagnoses I am supposed to code. The conditions which are not addressed, you are not supposed to code the ICD for that. One another example is there in front of you, Tanya. Can you help me? How many diagnoses can you see under assessment and plan?
4 diagnosis.
Absolutely correct. 4 diagnoses. So your first step is total number of diagnoses under assessment and plan is 4. Now, how many addressed? If you see here, GERD stable, right? So stable comes under,
Address.
yeah, stable is addressed. But out of the 4 criteria, where it comes under, is it a status or a treatment, or it's a test or discussion?
Status.
Yeah, it's a status. If you see peptic ulcer, doctor said condition present from last 5 months. Can you see that? Here they have written follow-up, but they have also mentioned condition present from last 5 months. So this condition present from last 5 months is a discussion point. Am I right?
Yes, sir.
Yeah. Whereas kidney stone, do you think kidney stone, this ultrasound abdomen they have ordered, do you think where it comes under? In which criteria it comes under? Is it a test or a discussion or a status or what it is?
Test.
It's a test, absolutely correct. Whereas if you see the 4th criteria is they are using the term only follow up. First of all, I have given you only the assessment and plan. But normally, whenever you code E&M, you need to see the entire note. Don't code only from assessment and plan. Just for your understanding, I have written here. But normally, as a coder, you need to read the entire history, physical examination, MDM, and then decide whether it is addressed or not. Right? So diabetes follow-up, they have written here. I don't have any evidence. So in this case, how many conditions addressed here? 3 conditions, right?
Yes, sir.
Okay. Now, whatever conditions are addressed, I told you, whatever conditions are addressed, only those ICDs you need to code. So if you see here, I have written the ICDs in front of a condition, that is GERD K21.9, peptic ulcer K27.9, kidney stone N20.0. But for diabetes, I have not coded. Why? Because it is not addressed. If diabetes is not addressed, you are not supposed to code the diabetes in this case. So it is not addressed. I am not going to code the ICD for this. Is it clear to you?
Yes, sir.
Okay, now we are going to see some examples. So now this is your turn now. If you see here, how many conditions you can see under assessment and plan?
3 conditions.
3 conditions, right? Or there are 3. Total number of diagnoses under assessment and plan is 3. Now, how many you can see are addressed? Can you see that? Diabetes, stable, pneumonia, follow-up, and GERD referred to another physician. So do you think how many conditions addressed in this?
Only one condition addressed, that is
No.
diabetes stable.
Absolutely correct, because they have pneumonia. They have not mentioned anything about pneumonia in the note. Nothing is there. GERD, they have not given any additional information. So in this case, diabetes is stable. Remember, I have given you only assessment and plan, but history PE also needs to be checked. Just for your understanding, I have given only assessment and plan, but you need to read the entire note and then decide whether it is really addressed or not. Just by looking at follow up and refer to another doctor, don't say it is not addressed. Check the note in HPI. Do you have the discussion point or a status point, or treatments? You can see and then decide. Am I correct? You understand that?
Yes, sir.
Okay, I hope it is clear to you. So total number of, now if you check here, Tanya, that we have given ICD only for diabetes. We have not given for pneumonia. We have not given for GERD because it is not addressed. So only one condition addressed, that is diabetes, and due to which we have given the ICD only for diabetes. Suppose there are some Z codes also written under assessment and plan. In that case, you can code all the Z codes. Z codes do not require address. Is it clear?
Yes, sir. Clear.
Okay, now we will see the example which is there. If you see here, I told you already that whenever you are looking at the chart, you need to check whether the chart is, first step, you need to check the chart is complete or not. It's an outpatient visit, yes. Now we will see history section is there, yes. Physical examination is there, assessment and plan is there, signature is there. All these 4 criteria needs to be there to call it as a complete note. If you see any one component is missing, in that case, you need to query to the provider stating that please provide the complete note. Is it clear to you, Tanya?
Yes, sir.
Okay. So, and be careful that you need to read the entire note. Okay, don't directly jump to assessment and plan. You need to read the chief complaint, HPI, ROS, past history, physical examination, assessment, and then conclude what would be your total number of diagnoses, right? So, after reading the entire note, we understand that yes, total number of diagnoses. Could you please tell me how many diagnoses you can observe under assessment and plan?
Only one, cirrhosis.
Only one. Absolutely correct. Only one cirrhosis. Why you're not considering right upper quadrant pain and history of lung cancer?
Because pain is a integral symptom of cirrhosis, and
Okay.
history we can't consider.
Okay. Z codes we don't count, whereas integral symptom also we do not count as a number of diagnosis. So as per your understanding, COPA total number of diagnosis is 1. Absolutely correct. And can you see the evidence that whether the cirrhosis is addressed? Yes or no? Is it
Yes, it
addressed,
is
Tanya?
addressed. They have given medicine.
Oh, they have given medicine. So it out of the 4 criteria, 1 criteria is present, that is treatment, right? Right, Tanya?
Yes.
Yes. So I hope you understand this, and I will give you a few more examples like this to give you the better clarity related to this. So the 2 criteria, remember, of COPA, that is the first which we have learned in our last session, total number of diagnosis under assessment and plan. And the second step which you have learned today, that is total number of diagnosis addressed, right? So two more steps are remaining that we will discuss in our later sessions. But it's my request to you that if you want to do quick revision, Tanya, you can go and check the my channel, that is Total Medical Coding. There I have placed that video of our discussion. You can take it from there, and for more details you, you can ask me. I will have a word with you, right? And if you want, you can share it to your friends. And this information, if you share it to them, it will be helpful for them, because nowadays people are asking about more of ENM. I think if your friends knows it, they will get the job. It will help them too. I hope you understand the concept very well. Do you have any question, Tanya?
No, sir, I don't have.
Okay, so whenever you, if you have any questions and all, please approach me. Thank you very much for attending this session. I hope you understand. I will give you a few more examples like this, so that during this period you can do practice some of the examples. So it will help you to understand the concept in a better manner. Thank you very much, Tanya. Nice talking to you.
Thank you, sir.